A very good evening to all. I am Dr. Jahanvir Chapuria. Welcome you for 7-day faculty development program on science of rehabilitation organized by Physical Education Department of Auro University and Spinex Global. Dr. Neeraj Bansali is the founder and COO of Spinex Global. Spinex Global established in 1996 and celebrating Silver Jubilee with a team of 60 physiotherapists and daily serving more than 400 patients. Spinex Global have two branches, one in Ghod Road and one at Tadwadi. International Physiotherapy Organization awarded Best Physiotherapy Center to Spinex Global in 2018. I would like to welcome my co-host, Dr. Neeraj Bansali. Welcome, Dr. Neeraj Bansali. Auro University is a premier university of integrated transformational learning for future leaders. A center for value-based education. The university focuses on providing to students an environment for the self-development. Physical education is one of the vital aspects of Auro University. The Physical Education Department at Auro University organizing many activities and events to develop various aspects of the self-being. In the past, we have organized activities like webinar of eye health by renowned ophthalmologist. Every year, the department organized international and national conferences on different theme of sports and physical education. This year, we organized international conference on sports culture in India, and more than 1,500 participants joined across the globe. As we all know, that physiotherapy is the science of movement. Its work with an injury, root causes, focus on both prevention and rehabilitation, and help patients to involve in their own recovery. Lack of activity destroy the good condition of every human being, while movement and methodical physical exercise save it and preserve it. The agenda of the FTP is to understand process of rehabilitation. Rehabilitation helping a person who has suffered an illness or injury restore low skills to regain maximum self-sufficiency. Rehabilitation is not only helping person to recover, but it has a huge potential to prevent the injury also. Moreover, to make this journey more interesting and simple, we have with us today Dr. Mary. Now, I would like to request Dr. Neeraj to share the Dr. Mary's introduction. Dr. Neeraj, please.
Thank you very much, Janvi, and I thank Auro University to collaborate with us and for trusting our abilities. Thank you so much for joining hands with us. Thank you all the viewers and participants for registering in such a large number. We are overwhelmed for that. Thank you so much, everyone, and thank you, Mari, for joining us. Friends, I would like to play the AV we made for introduction of Mari from Finland, who is going to teach us about the Vasa concept.
We have an international guest speaker with us today,
Mari Tinkanen. She is a Vasa concept therapist and supervisor from Finland. She also works as a research organizer on Vasa Concept Global Association. She has been in the field of rehabilitation for 13 years. She is trained in Finland with the traditional approach and use of most modern high-tech devices for support and balance of brain-injured patients. Finland is a very rich, modern country and ranks very high in healthcare of its people. She has a unique strength to explore for more possibilities to give the best and do the best for her Finnish patients. This unique attitude and strength to do the best for her patients made her get to know about the Vasa concept from an article in the Finnish newspaper, and she decided to attend the workshop by Dr. Rajul Vasa. Mari's journey began from 2015 to become the Vasa concept practitioner when she saw that the patient's gait improved without gait training and upper limb improved in just 1 week. Spasticity disappeared and fingers, wrist moved many years after stroke. Vasa concept puts the patients with brain damage on road to true recovery by restoring the lost motor control. Today, the Vasa concept is being practiced in India and many countries across the globe. Mari now wants to give amazing results with Vasa concept to all the patients of the world.
Yeah. Friends, we are having Dr. Rohit Singhi, director of Oro University. I would like to call Dr. Rohit, sir. Sir, welcome to the FPP. Uh, yeah, Janvi, please.
Good evening, Dr. Singh. Good evening, sir.
Thank you.
Yeah.
I would like
It's
to
a pleasure
invite
to be with
Dr.
you.
Rohit Singh to deliver.
The first 7-day rehabilitation, which is scheduled from today, and it will go till 14 August 2020. And I extend my warm welcome on behalf of the Physical Education Department, collaborating with your Spinex organization. And based on that, Dr. Janvi suggested that we should have this FDP because it is a need of the hour. We have not able to find a right set of mix of people, practices, and process when we think of rehabilitation and the various means of rehabilitation. And Dr. Janvi has very rightly designed the program focusing on the different aspects. And we have speakers when one Mr. Saurabh Mehta, who will be focusing upon understanding the meaning of frailty, prevalence of frailty, common approach to testing and managing frailty. And to be very honest, a lot of the people who are into the physical education and who are into the sports stream per se into the different universities, even they need this guidance. I think it is very aptly designed at this point of time where we are going to understand the different concepts of frailty. Then moving on to, we have the other speakers lined up, and this will be moving on to the next 3-4 days. The second one will be on the hand assessment and rehabilitation, which been taken by Dr. Naujud Trivedi, who is the principal and the head from the Parul Institute of Physiotherapy. And if you see the lot of education organizations who are involved into the sports and physical education come, uh, they put physiotherapy under the what you call science of medicine, and they put it under as one stream where the students are studying about different notions of medical science as such. But in the sports department per se, these miss as on date. Third is topic is by Dr. Jatin Maheshwari, who will be focusing upon applied exercise physiology during the sports activities, and he's the director, Crosby Institute of Health and Sciences. Uh, Fourth, Dr. Marie taking Finland. She will be focusing upon Vasa concept in Finland for neurological patient. And then last will be Dr. Ravi Solanki, who will be talking about the cardiopulmonary aspects. I hope, Neeraj, that with your long experience into this, where we need a strategic collaboration with a different organizations who are working into this field and who can be brought at par with the requirements of the education system. To be very honest, we may be very good into curriculum, we may be very good into the delivery of the curriculum, but when it comes into integration of different aspects pertaining to physical education in the sports, I think we are missing a lot on that. And it will take time for the university like us to bring those elements into our daily teaching learning classroom process. So I thank you for extending your support to us into the 7-day FDP, and looking forward for an teaching session from you and the other speakers during this 7-day of faculty development program. Thank you so much. Janvi, ma'am,
Thank
over to
you.
you.
Yeah. Thank you, sir. I would like to again share a brief introduction of Dr. Rohit Singh as we missed out. Dr. Rohit Singh is presently working as a professor and dean academic academics at Oro University and has a teaching experience spanning over 17 years. He has to his credit a PhD in advertisement from the Department of Commerce and Business Administration, Munir University of Allahabad, and Master's Diploma in Business Administration and Post-Graduation degree in Commerce with specialization in Marketing from Banaras Hindu University. Dr. Singh has published nearly 20 papers and articles in various international and national journals, contributed chapters in various books, attended 3 dozen seminars and conferences, and more than 11 QIPs, MDPs at IITs, IIM, IIFT, VNSU, Surat, AIMA, and leading management institutes in the area of marketing, strategy, research, methodology, and finance. Dr. Singh, thank you so much to giving your valuable time to us during the inaugural session of the FDP.
So I just want to focus here, Neerajji, that
Thank you very much.
you were in the past, if I remember correctly, and we are focusing on the 4 different aspects of education at the university system. Those are physical, mental, vital, spiritual, and physical component. We really lay an emphasis that all the students should go through the different aspects of physical education, and it is not only related to the sports as per se, but all the different elements which a good physical, agile, and endowed body should have there. So I hope this FDP will also highlight those issues and take to cognizance the various aspects of physical education related to sports and its treatment. Thank you so much.
Now, before starting FTP, I would like to share a few rules and regulations to the participants. That during live FTP, all the participants have to enter the same email address and the name in the YouTube chat section to prove your presence at 3 given intervals. We will share a feedback link. You have to submit feedback link every day with the 3 screenshot which you have taken during the session. Now, I would like to request Dr. Neeraj to please coordinate with Dr. Mary and we can start the session of day 1.
Thank you very much.
Dr. Neeraj.
Dr. Rohit Singhiji and Dr. Janvi Ichapuria, I thank you very much and the entire Oro University team for trusting our abilities and for giving us this opportunity to work with you. It is a pleasure for us, and I wish the viewers will get the best out of it. Thank you so much for this. So without wasting any time, I would like Mary to, please, Mary. Hi.
Hi.
Hi,
So
how are you?
I am on air now.
Yeah, welcome. We are going to begin our FDP program from your webinar first, that is based on the neurological rehabilitation on the Vasa concept. So thank you so much for your confirmation, and we are eagerly waiting to learn from you, ma'am.
Thank you. It's so nice to be in here today.
Shall we start the program?
Yeah, I'm ready.
Yes, please.
Yeah, fine. Thank you
Dr.
so
Mary,
much.
now, please, floor is yours.
Excuse me. I have shared the screen.
Yes.
It's not showing. Or is it?
Yeah, it is there, ma'am.
Okay.
Yeah.
Okay. So, good evening for everyone. My name is Mari Tynkkynen, and I am from Finland. First, I would like to say thank you for Spinex Global and Dr. Neera Pansali. And the most grateful I am for Dr. Vasa from all the things that she has taught me in these last years. Today, we are talking about Vasa concept and how you can start your journey to learn to be Vasa concept therapist. I'm also a supervisor, and I am research organizer and vice chairman on Vasa Concept Global Association. I am doing my master's studies internationally, And after 2015, with Vassa concept, I have had amazing rehabilitation results with patients, and you can see pieces of those today. My youngest patient is 5 months old, and the oldest is over 80 years old. So Vassa concept works with from babies to grandmas and grandpas. Then on webinar time, I hope that you are using the chat. But after the webinar time, if you have some questions, I would like you to contact us through our Vassa Concept Global social media pages. So we are there almost all time, so it's easy to find us. And then we come to the most important person, the inventor of Vassa concept. Dr. Rayul Vasa has studied also abroad, and she's now also working all over the world. So we can really say that Vassa concept really works in every country and all the stroke and TBI patients and CP patients. Then we come to the birth of Vassa concept. Vassa concept is really thinking out of the box. Dr. Vasa has really thought out of the box and asked these questions, which has given birth to Vassa concept. That is the reason why today we are doing so many stop and think now. So we learn to think out of the box. And the most important question is that if I was the victim of brain injury, would I accept to be dependent and suffer for the rest of my life? What about my dreams? Dr. Vasa traveled all over the world asking these questions. When she didn't get the answers, she decided to find answers herself. So Vasa concept is the solution to end dependency from a life of brain injured and make them live their dreams. And the second important question is that is it possible to get patients back to premorbid state? And that means that like patients were before the accident or sickness. And I would like to ask from you that how many times you have seen brain injury patients to get back to premorbid state, exactly like they were before the brain injury. I hope that you are sending messages on the chat. What are the reasons for the damage to stay irreversibly for centuries? So why our patients are not recovering on premorbid state and continue their life like they were living before something happened? Why they are staying disabled? We really need to find the root cause for this complete solution. And Dr. Vasa has found the root cause, and based on that, Vasa concept has born. And why we need Vasa concept in Finland and all over the world? I think that this is not only Finland's thing. We need Vasa concept in every country. A little bit first about Finland. Finland is part of Nordic countries in Northern Europe. We have much less people than you have in India, but we have lots of beautiful nature. And I have here added some where we are famous of. We are famous of healthcare, the well-being of citizens, technology, and games. Perhaps you have heard about Nokia or Angry Birds, or our athletes like Kimi Räikkönen or Teemu Selänne. If you know some other people or things that comes from Finland, it would be nice to hear that. And I live in Eastern Finland. I live in a very small town. It is called Savonlinna. I am showing this for you that you can see how different country Finland is. And even we are known from healthcare and technology, we still need Vasa concept. These all pictures are from Savonlinna. So you can see that everything changes during year. Even there's lots of similarities in Finland and India. Still, we are two totally different countries. And we have about the same percent having a stroke in every year. I think that TBI might be more common in India than in Finland because of heavy traffic in India. But we really need to get these patients back to normal life. It doesn't matter which kind of like country it is. We need to save every stroke and TBI and CP patient and help them to live their own dreams. In Finland, we have high taxes. We are paying taxes from salaries. Companies are paying taxes. And we are paying taxes every time when we are buying something. Also when we are buying food. And the problem in Finland is the dependency ratio. You can only imagine how much employed persons are paying taxes. That is it possible that our dependency ratio is like this? We have lots of high-tech, high education, great hospitals. Finland is a great country. I like to live in here. But stroke rehabilitation results could be better. And it needs to be because of dependency ratio. Because it doesn't look like that it can get any better in a couple of years. Yeah, today I'm not going to say how things are or aren't. I just want you to stop for a moment to observe and think out of the box. I am thinking that Vasa concept is the invention of the century. And when you are learning something new, first comes the thinking. So today we are focusing on thinking part. Second comes that you can explore things with your own body, and then you can do hands-on practice with your patients. And after that, you are ready to learn the theory. Learning a Vasa concept is a long journey. Year by year, you are coming better and better. I hope that someday you will get to know that Vasa concept is so much more than these points. These are only for that we can start the thinking. The process is starting. You are most welcome to learn Vasa concept levels or some different names to learn theory and also Vasa concept webinars and courses. And then comes the first, think out of the box. Think of today and compare it to history. If we are watching this picture, we are seeing that 100 years has gone by, but the results are the same. Something needs to change and quickly, because we need these patients back to work, back to normal life, and pay taxes, and enjoy their lives and fulfill their dreams. And these men are not the only one. This happens all the time, that we are not able to get patients back to normal body and back to live the normal life. But this is good picture for showing that even these are well-known men and they have had lots of rehabilitation. Still, the problem is the same. USA Senator Mark Kirk has possibly the most amount of high-tech tools for rehabilitation in the whole world. The Mark Kirk has walked more than 10 miles. And still, I'm thinking, is this the best result that we can have? Is the all that we can do? And is the patient happy with this? Do they want something more? And then, what word think as a rehabilitation exercise? And here you can see how the Mark Kirk has done the exercises. I hope that you are hearing this video, what they are saying. But they are now explaining that Mark Kirk has had the stroke. And it was all over the news in USA. And then the Mark Kirk is explaining about the rehabilitation. And I hope that you think that how much the Kirk is using his better side of the body while walking, even on robotic training. I hope that you are hearing my voice, even the video audio is not now working for some reason. And I would like to ask also that why walking is a symbol of recovery, where the reason is coming from. And is this a normal gait? Is this what we want? And just check the spasticity in there. And look at the cane and abnormal gait. And then we are going to next one. What we see as a result. Now it's Mark Kirk's first workday. He is getting back to his work. And is this really the best result what we can have? There's so much spasticity. There's the cane. The upper limb is so up there. So I am asking again, why we are using walking as a symbol of recovery? Because the walking, that walking is not normal. It is not a normal gait. And here is the doctor saying that Mark Kirk is not likely to regain a full range of motion of his left side. So doctors around the world needs to know that it is possible to recover. Because this is from the USA, and I think that they have the most amount of high-tech and robotic and everything. And there's something is not working now if the results are like it. Yeah. Are we getting better results with Vasa concept? Now I am showing you what really is possible. Mark Kirk has repeated walking and you now have seen the results. If you repeat Vasa concept, results are totally different and you can see those on the next video. So you really need to think what you are repeating. And on this video, there's text everything what you need to hear. So no voice in this video. So I hope that you start to analyze the walking. You are checking the pelvis and buttock and knee and ankle and everything. How is it working? What are the splints doing and what the leg inside the splint is doing? Which side of the body is doing the more work? And here is the hand in the beginning. There's lots of spasticity and stiffness. And soon you can see that from this hand, you can get the spasticity into active movements. And I would like to ask from you also that did you know that this is possible? Because this is totally different than Mark Kirk's results. Fingers are opening and closing now. And exercises are so easy to do at home. You don't need to go to the gym to do these exercises. You can do this at home. And check the whole body. The arm is not the only thing that has changed. Check now the pelvis and when you are walking in a squat position, how that is making walking better. And from here you can see that there is no spasticity anymore. And from one exercises you can practice the whole body. And check the quality of the movement. And if you still remember the walking in the beginning, and now you can see how the girl is jumping. And you need to also remember that braking movements are important. It is also important to come down from stairs. And here's another example for how with one exercise you can practice the whole body. So goal in Vasa concept is also walking. And now compare this walking. Can you notice all the difference from the walking earlier? How is the buttock and pelvis? How is the knee? And the ankle and the foot? And our patients want recovery like this. They don't want recovery like Mark Kirk has. They want recovery like this one. And I would like to hear what are your questions right now. I hope that you are writing questions on the chat or through social media pages that I can read those also. Here are the questions from my mind when I saw this video for the first time. I was thinking that how this is possible, what made this possible, how this patient learned to use right muscles while walking without any gait training. So it might be quite important that what you are repeating. How to change spasticity to active movements, how to end paresthesia, how to help to remove depression so that patients fulfill their dreams. And the most important thing for me is that how we are able to get patients' dreams come true, because they deserve it like anyone else. And can we do this? And of course we can. And first we were thinking of today, and then we compare it to history. And next one is that experience with your own body. If you have learned to thought about muscles, then let's do that together for a moment. Now, let's see Mark Kirk's gait training video again, and write on the chat the things that you are seeing. I would like to hear what things are you observing when you are watching this. And on the next slide, I am telling some of the things that I am observing when I am watching when hemiperson is walking. And once again, I hope that you are thinking that how much the better side of the body is working and how much we are helping the paratic side. I'm also reading that what you are writing on the chat at the same time. So please write there what you are seeing. Oh, now there's come good. There's circumduction in the gait. Pelvis is tilting. Good. You are seeing things. And here's some thoughts that what I'm thinking when I'm watching that walking. I am seeing that arm is rising up in synergy grouping. I see that pelvis is twist. I see that buttock is not activating. I see the knee is in recurvatum. I see the ankle is stiff and there's the orthosis. And I think that there might be foot drops and foot is supinated, but there's the orthosis, so we cannot see everything. And there's the red circle, and you can see how the marker is putting all his weight on the better side of the body. So the paratic side of the body is only follower. The better side of the body is doing the work. And also, Mark Kirk is also watching on the ground. So there might be poor proprioception, which leads to compensation with vision. Therefore, patient is using his eyes to look at the ground. And this all we can change with Vasa concept. And now we are practicing more this analyzing. And once again, you can see how the arm is rising. How is the pelvis? How is the knee and ankle? And now even therapist comes to show that lift your leg like this. But even the girl is standing. You can see how the knee and ankle is. And once again, I would ask that what we are repeating. Is it good that we are repeating abnormal gait? Or should we repeat something else? Oi, oi, the knee doesn't look nice. It's nice that you are also writing in the chat things that you are seeing. Because with almost every hemiperson hemi walking, you can see the similarities. And now the girl is on the treadmill, and you can see how she is using his better hand also for support the balance. And I think that we can do better results than these. I know that these therapists are doing their best and they try their best. I know I have also done exercises like those. So I know the thing. Everyone is doing the best what they can do. But also from treadmill, you can see how the knee and ankle and foot is, and how the arm is rising. Nice. You are writing very good in there in the chat box. Good. Very nice. And then comes the second one. And now we are seeing how the walking aids are affecting this. This video is a good video to learn how walking aids are affecting to walking and how patients want all the way to the better side of the body while walking. And here is how the man is walking at home. At least they are saying that on the video. And from this video, you can see how the whole body weight is on the better side of the body. The man is not even straight position. And then they are making the whole walking aid a little bit better. They are making it a little bit longer, if that affects to the walking. And now you can see how that is affecting. Good, someone is writing there that there's a asymmetrical gait pattern. That is true. Total body weight on normal side. Yeah, that is also true. What else are you seeing? The therapist is also giving some guidance there, how to walk. And then they are using also different kind of sticks for walking. And you can also see how the arm is rising in synergy grouping. And the last one is that the man is having splints and orthosis, and then they are starting to walk. Soon I present you an idea how this man could walk even without the splints. But first we need to see how this man is walking with the splints. Okay, and now the man is going and we can see how he is still locking the knee. Here there's good on the chat that there is not heel strike. And then the therapist is saying that hopefully you walk like this because they decided that that is the best what they can do. But I think that we are inventing something even better when we go further on this. And now, please experience walking like a hemiplegic patient. I hope that you walk exactly like you saw these patients to walk. And I see from the chat group that you are eager to learn more, but be patient. You really need to do all these steps that you will understand the whole thing, because Vasa concept is such a huge thing and there's so much theory. And you need to experience things with your own body and with patients' bodies that you can understand this whole thing. And when you have walked like this hemiplegic patient, I would like to hear answers to these questions. That what muscles are you using? How is your foot? Is it totally against the ground? How is your knee? How is your pelvis? Where does it hurt? And after walking a while, like 5 to 10 minutes, where is your arm? Does it rise up? Even your hand is not bleeding. Have you thought about this? That your arm is rising, even it is not bleeding. Have you thought about this? How the arm is rising in a synergy grouping? And what about the proprioception? What happens when the lower limbs is not totally on the ground and the body weight is more on the better side of the body? What kind of information are you having from your body? So, ear rating affects in this walking. Good, you are answering also to this. Yeah, someone was asking there's something that not putting weight on the affected side. Yeah, that is on the way you need to walk. I'm waiting for some answers in there, so I will know that you have done this, because we cannot wait now 5 to 10 minutes, but I hope that you are doing it even for 1 minute. And after our session, you will do this like 10 minutes. And if you are doing this 10 minutes today, tomorrow, you will understand so much things. And you will understand the next slide. But before that, abnormal pattern occurs because of unloading the limb. Yeah, that is true. Yeah, and it was good point from the earlier video that patient is pulling his affected body by normal side body. That's true. Yeah, and circumduction. Remember that when you are trying to walk like hemiplegic patient. Yeah, and then they are tracking the affected leg. Good, you are doing this. And if you are doing the exercise 10 minutes today, you will know the answer for this tomorrow. So, where it usually hurts? Usually there is spastic pain in the upper limb. There's pain in the ribs and lower back. And there's pain in the whole lower limb. And usually they are also pain in the toes, and the toes are glowing. But if you do this exercise, you will understand how much there is pain in the better side of the body, because it is doing the most of the work. It is hard to push and pull the other side of the body when you are walking. It's very good. Someone write there that even at spinal level there's inequality. Inequality. Very good. And when you are doing this gait training exercise, remember that usually there's the poor proprioception, so eyes are watching on the ground, and which can give the neck pain. So I hope that tomorrow when we are continuing, you write something about this exercise. That you have tested with your own body, because I hope that every time when you are having the patient, you are walking like that patient. Then you are getting so much information about how you can help that patient. But then, can we do something better? And now I'm getting a little bit back for the man who was using the cane, walking on the video. So, what is the difference when you walk with knees bent? What is the difference on hemiplegic side? What is the difference on foot, knee, hip, pelvis, trunk, arms, in the whole body? What is the difference on COM? And is it more safer or not? And here is video from a man who is using a cane, but he is walking with knees bent. And I put the video again, so you can see that there is no splint on the leg or the arm. And the arm is just hanging it is not rising up. And the reason might be that he is walking knees bent. And it would be nice if we would be able to get the man who was on the video and ask him to walk knees bent. What would be the difference? Could he walk without the splints? Somebody said that this is not safe. Let's watch again. How come this is not safe? Or it was on some other video. But walking on knees bent, at least for me, this is looking much more safer than locking the knee. Yeah, there's less fear of fall. Very good. We are talking, I think, tomorrow about fear of falling. And now there's a next exercise for you. And you have said there that it looks less asymmetrical. And now I hope that you experience walking like a hemiplegic patient with knees bent. So you can see how it is different, how you can make a change with little correction. And how it's changing the whole body only by bending your knees. And when you are experiencing, think how it changes what muscles you are using. Does it change how your ankle or foot is? Or is your foot more against the ground? And does it change something on the pelvis area when your knees is bent? And where is your center of mass when you are walking on knees bent? And after walking a while, is your arm rising? With this video, what we were seeing, the man who was walking knees bent, the plegic hand was totally relaxed. And hopefully that also happens to you when you are walking like a hemiplegic patient, but knees bent. And I'm just checking the chat once again. You are doing good work in there. You are seeing now how little things can affect a lot. It would be nice to do this exercise once again, like 10 minutes. But I hope that you will do it after our webinar. Good. Many has noticed that there is less fear of fall. This is very good because then it's easier to continue from that tomorrow. So now we have thought about today and compare it to history. We have experienced things with our own body, and now it is time to think behind the action. And the question is, that can the brain be reorganized in spite of lesion to give true recovery? That is the solution, and one of the keys is proprioception. Today and tomorrow we are giving you some keys, but more about those keys you can learn more by continue this Vasa concept journey. And this question is so good that I hope that you are reading this many times. Can the brain be reorganized in spite of lesion to give true recovery? So where is the problem? Is the muscle the problem? And what we should fix and how? And I also want to ask that what we should repeat. Is the problem in skills or action or somewhere else? Like I was asking, is the problem in the muscle? Or is the muscle the problem? Now I'm asking, is the problem in skills or action or somewhere else? At least in Finland, we are using these categorization boxes. And in the school, we were mainly taught about skill and action exercises. Like in the most known exercise methods are based on skill or action training, like constraint-induced movement therapy and gym training, and all the walking trainings. And Vasa concept is the only one where you are thinking how you are able to get skills and action and gait back without any skill, action, or gait training. Vasa concept is really fixing the roots. This is something that I have taught many times, that when I am doing action and skill training, can the abilities even get better? Can it even go from up to down? And why we are focusing on action and skills if the problem is much more deeper? And it is even more deeper than these abilities. Vasa concept is really focusing on the roots behind everything. And you will learn everything when you continue this Vasa concept journey with us. And there is happening so much things inside of the patient's body before we can see the movement. The whole paralytic side of the body is waking up. So, before we are able to see the movement, proprioception needs to wake up and spinal plasticity needs to be exploited. Fluid and blood circulation, cell metabolism wakes up. Have you thought about these things? At least when I have been teaching therapists, and usually they are saying that I haven't thought about this. I'm only focusing on the movement. And I understand totally, because we are trained to do that. We have been trained for focusing on the action and skills. Our focus is not on abilities or on the roots? But by when we are able to get the body waking up, the touch sensation report as a byproduct of Vasa concept. We don't need to even practice the touch sensations. And the movement report as byproduct of Vasa concept. We don't need to exercise the movement either. We are just fixing the roots. And everything will come. And another key is a spinospinal plasticity, which is going to make it or break it. And that is also something that you will learn much more on theory courses. This is what you can accomplish when you forgot the skills and action and you focused only on abilities and infinite possibilities of body, brain, and gravity. And now I hope that everyone will forget the skill and action training for a moment, and then what you can accomplish when you focus only at the root cause, the body, brain, and gravity. Many people have asked there that tell more about Vasa concept. I think these are the main points. But of course, inside of the every word, there's the 1,000 pages of theory. But when you remember, you are using the patient's body and brain against the gravity. We don't need any high-tech tools. We have everything what we need. And this girl has done task and action therapy for 3 years. And after it, the upper limb was spastic, painful, and with no movements. So she had a chronic stroke. And then we started. We exercise only with body COM and gravity with Vasa concept for 3 years. So same amount of time. And now she has movements in the whole upper arm. Let's see. And there's also text in this video. So when Kaisa started, there was no movement in the right arm. Even she had 3 years of intensive therapy. And with Vasa concept, in 3 years of Vasa concept, results are totally different. In the beginning, she couldn't lean on the right arm. You can see how there's people assisting her, and there was so much spasticity. And with Vasa concept, she can do things on her own. And so much less spasticity. And here you can count how many people are assisting in this star exercise. And with Vasa concept, she can do it by herself. So now there's the movement all over the right upper limb. On the upper arm and forearm. She can control the wrist. Think that she learned this after 1 year. And how much less there is spasticity now. And think how hard is to get that kind of like movement on the wrist if you are doing something else than Vasa concept. In 2019, fingers started to do extension against the ground. So now we can say bye-bye to spasticity. And Kaisa is professional and international opera singer. And you are the most welcome to follow her on social media. She's amazing singer. And she has videos on social media, so get to know those. So, when you exploit the brain and body coupled with gravity, skills and action will emerge automatically. So, you only need to do the Vasa concept and everything good will follow. And here's the one exercise what we have done. And you can think how the brain makes avalanche on paratic muscles. Do we leave any choice for paratic muscle not to contract? Do this exercise with your own body and you will experience how effective exercise this really is. And it is for the whole body once again. You are leaning from the on the paratic side of the body. And everything will happen. Even the theory from Vasa concept is huge and you need to know many things. But you can do these exercises with your patients even you don't know the whole theory. Because exercises are simple. The exercises are so simple that you can do it at home. You can help the family to do those with patients. Then I would like to hear that have you had some new thoughts today? I'm checking the chat, that what you might write in there. Thank you from all the good thoughts that you have sent in there. We have still some slides left, but I would like to hear that have you some new thoughts today? I think that you are also in Vasa concept now, that and you are only saying yes, you have had some new thoughts, but what kind of like new thoughts? That would be nice to hear. Thinking out of box. Good. We'll continue that tomorrow. Now we know that gravity is important or something like it was there. Okay, I think that I need to check all the chat box after this. And if you have some thoughts, you can also send those through our social media pages. It's easier for me to read those. And if you want to find more information, Of course, we are continuing tomorrow. But there's the YouTube channel, Rayul Vasa Foundation, and there's lots of material about theory. There is before and after videos. And on YouTube channel, Vasa Concept Global is under name Vasa Concept Finland, because we have also videos only on Finnish. But it is nice if you support our work by liking our pages. And on Facebook and Instagram, you can find Rayul Vasa Foundation and Vasa Concept Global RI. And you can download the ebook from brainstrokes.com. And I recommend for everyone to read this ebook. It is very good ebook, and it will give lots of answers for your questions what you may have right now. And from there you can also see the exercises, at least some of the exercises, not all of those. And then there's also a very good page for Vasa Concept for Cerebral Palsy.com. And that is very good for all the therapists who are working with CP children. And also when you are working with stroke patients, you might get some new information also from there. And then there's our Vasa Concept Globals page, vasaconcept.fi. And from my webinar, you can download checklist by joining our email list. So it's on this page. When you select here the English, then comes you come on this page, and from there you can join our email list. And when you are on our email list, you are first one to know from new Vasa Concept webinars and courses. And I think this is the time that I say also thank you to you. And here is where you can find us after this webinar. And I think now it's time for your questions. If you have some questions.
Viewers, if you are having any question, please write down in the chat group. Thank you, Mari. It was very informative and quite new for all of us. It's very helpful, and constantly we are getting lots and lots of message. Even you might be reading the message about your presentation. They all are so happy and appreciating the way you are explaining the concept. They are very happy.
Thank you. And we continue tomorrow.
Yes, we will continue tomorrow.
Interesting things also tomorrow. So please welcome all.
Yes. And time is not a bar. You can teach us for hours together. We are absolutely open for that. So we all are here to learn from you. So you feel free. Don't bother about the timings. Means tomorrow also.
I think
viewers,
that
viewers, we will share the link in 5 minutes. So you just click the link and fill the form for your presence. Meanwhile, we will take your questions.
Okay.
Hi, Janvi.
Hi. Hi, Dr. Mary.
Yeah. Hi.
I'm good.
Friends, if you ask a question, you write Q in front of the question, so it's easy for us to understand.
We have one question from Ayush. His question is, what does hemi walking means?
Hemi walking means that
Dr. Mary?
walk like hemiplegic patients.
Okay. There
How
is
I
one
can
more
explain
question
that
from
more?
Gaurav, that how. Yeah, please continue.
No, please tell. Yeah.
The next
Should I?
question.
Yeah, Janvi, please ask your question.
Next question is from Gaurang. How to improve finger movements in the hands and the foot?
Well, it's the key from the Vasa concept. And Vasa concept is to expand the boundaries of center of mass movement on the parthic side of the spine. And when you are doing this, and the Vasa concept exercises the parthic side of the body, the upper limb and the upper arm is getting better. Everything will happen.
Okay.
Yeah. This is another question from Raji. Can Vasa concept help kids with Enavan disease?
What disease?
Enavan disease. CANAV. You can read on the screen.
Sorry, I don't know the Canavan disease. I haven't heard from it.
Yeah. This is another question from Kusum. Can it be applied to the herbs palsy patients?
For CP patients, Vasa concept is very good with CP patients. I recommend that to all CP patients.
Okay. There is one more question from Kishore, that what is COM?
COM is center of mass. So that is the short form from it.
Okay, there is one more interesting question from Payal, that what is the difference between conventional therapy and Vasa concept?
In conventional therapy, actually, I have thought about it for last hour about what is the difference between these two. But maybe you should check this webinar again and see how the conventional is more about the gait and skill and action-based therapy, and Vasa concept is in the roots. We are taking care of the roots, that everything will emerge automatically. And conventional is only that we are treating what we are seeing, like we are treating the gait or we are treating the muscles. Vasa concept is the only thing what is treating the root cause.
One more question from Tejal, that how is it possible to change the tone after post-stroke 3 years when neural plasticity is already there?
Like from the Kaisa's video, you can see that Kaisa had 3 years before she started to do Vasa concept. And from that video, you can see how things are possible, how the plasticity is happening when you are doing the right things. And tomorrow, actually, we have one video where
There
is
is this
4
question
years
from
after the accident. Yes, sorry, next question.
Okay. Next question is from Italia, that is it Vasa concept is for both sensory and motor impairment?
Yeah, if it's because of stroke or GBI or CP, or something has happened in the brain. That is the reason.
Okay. Uh, Tosha wants to ask that what is the recovery rate of Vasa concept for stroke and CP? Does improvement occur in all patients?
If they are doing the exercises, I have seen the improvement for all patients. But if they are not doing the exercises, of course, it cannot work.
Then next question is from Dina. How long will it take to recover within Vasa concept if the patient is in grade 4 spasticity?
It always
From
depends
Dina.
about the patient. We cannot say how long. Does it take months or years? Because it depends on the patients.
Okay. Khushbu wants to ask, does it apply on motor neuron disorder? Khushbu
I
Shah.
think, yeah, but if I heard it correctly, I think that is degenerating disease. And Dr. Vasa recommends to enjoy live king sites, and but things might change from country to country. But when there's degenerating disease, it's better than you focus on living your life as full as you can.
Mr. Sudhir Rana wants to ask that if any person have a bone TV, what exercise they do? Sudhir Rana.
Okay, can you repeat, or I wait that it comes on a text form?
It's gone from my this list also. I'll find. If any person have a bone TV, what exercise they do?
Born with TB. Is that what you meant?
That's what he
It
wrote.
is not possible.
Yeah, that's what he wrote, ma'am.
Okay. I think that they have born with CP. And what is the exercise what they can do? I think I recommend that they will watch the Vasa concept for cerebralpalsy.com and check some exercises from there and learn more about Vasa concept, and you can help patients every day more and more. But you cannot do everything on a one day. This is a long journey.
Parmar Shilpa wants to ask that if patient having subluxation, so we can use Vasa concept.
What was the word? If person has
Subluxation. Subluxation. SUB. You can read Parmar Shilpa message from Parmar Shilpa.
there comes now so much messages that
Yeah, actually, she wants to ask about the subluxation.
if you have shoulder
Subluxation.
subluxation, you really need to do Vasa concept, because uh, the pain in shoulder is getting less and less all the time. That is something that I have seen with my Finnish patients so many times, that when you are doing Vasa concept and your shoulder is subluxated, did. It's when you are leaning against the hand and you do all the exercises, it's getting better and better. The muscles are activating, and there, of course, when the muscles are activating, then the shoulder is okay. So there would not be any subluxation.
So from your point of view, the major reason of the subluxation in most of the neurological condition is mainly because of the inactive state of the muscle.
There's also some other reasons, but that is one big reason for it.
There is one interesting question about the geriatric patients. Shraddha is asking that can't it be difficult to manage the geriatric patient on the floor and go for star exercises?
Of course, you need to think what kind of exercises you are doing at with whom. Because you can do also Vasa concept exercises over the bed or some other soft area. Or when you are working with children, everything can be so playful and fun. You can do the exercises good for every patient.
Yeah, another question related to this comes into my mind regarding the OA patient, because in geriatric patients, it's pretty common to have OA knee condition. So which kind of care do you take when you are asking patient to go through the Vasa concept, like kneeling? You avoid those kind of activities, or still you prefer to give weights on the knees as well?
Once again, it's different from every patient. You cannot say that this is the way you can treat everything, or all the patients are doing the exercises same amount, and it's different to every patient.
Yeah, that is
every patient is doing different exercises.
Yeah, that's very, very true. But if someone is with OA knee condition, then do you take any special caution to avoid any kind of stress over the knee while prescribing Vasa concept exercises?
I take care that everything is safe when I'm doing the exercises.
Okay. Kavya is asking which techniques does Vasa concept use for rehabilitation?
Which technique? Vasa concept is not actually technique.
Yes.
It's the whole concept.
Very true.
And if you want to think about technique, then you can go back to the slide where there was the brain, body, and gravity. They are the main things what we are working with.
Janvi, you please ask this question. This question. Can you see on the screen?
What is the exact meaning of Vasa concept exercise? That one or?
No, this one. Is Vasa concept applicable for all types of CP conditions?
At least I haven't seen that kind of CP that Vasa concept would not be good. Because Vasa concept is good even
there is
the
a question
CP
from
is severe. Yeah, please.
Okay. Yeah, there is question from Nusheti. Is it really effective after ACL surgery?
ACL surgery.
Nusheti Suresh.
I don't know about the surgery.
No, that is actually ACL ligament reconstruction surgery. I think he is asking about. You see, friend, ACL reconstruction is an orthopedic condition, and we are talking about the neuro rehabilitation. So, if a patient with neurological problem has undergone the ACL reconstruction, then definitely they can do Vasa concept treatment as well. But Vassa concept is mainly for the neurological rehabilitation. It's not for the orthopedic rehabilitation. So don't mix both the things.
Yeah, thank you for answering that.
Sorry.
Yeah, it was very good that you answered.
Yeah, Bhavesh Pamnani is asking, is Vassa concept help in chronic case that is almost 6 years old?
Yeah, it's also good for chronic cases. We have had results even if there's 10 years from the stroke. So everything is possible.
Abharam Johar is asking that are there any principles underlying Vassa concept?
Principles. I think that it always what you mean about the principle, but there's lots of the keys like the proprioception and spinal connectivity, and then there's the brain, body, and gravity. So you can keep those on.
Yeah, perfect. Friends, I would like to tell you that we have already given the feedback form links in the YouTube as well as Facebook page also. So you can fill those forms and submit it for registering your presence for the certification. Ma'am, shall we take more questions?
If there is something interesting, but I can, something if haven't come up yet, I can answer, or I can answer tomorrow also.
Tomorrow there will be many more questions.
Yeah, that's true.
So this is from Shonan, that how to begin with Vassa concept exercises with the patient. Is there a particular approach to do to it?
It's a little bit different in where you are. Are you able to go to Dr. Vasa's workshops with the patients, or is it good for you that you are finding all the information from the internet, and do you start with that information, or are you coming to Finland to workshop to learn, or are you contacting to some therapist who knows about Vasa concept and ask some guidance? It's every time different.
True.
But you need to get information from somewhere that you can start.
Perfect. One question I would like to ask you that the Finland workshops you arrange for the Vasa concept, that is in which language? In Finnish language or in English you organize?
In Finland, in Savonlinna and in Kokkola, we have organized these workshops for patients, and there have been patients from Finland and from Sweden and from Europe and from USA. So I think that we are using Finnish, Swedish, and English with the patients. And if you're meaning about the Vasa concept level 1 course in Finland, of course we are speaking Finnish because we are in Finland. But if it's in some other country, then it is on English.
Fantastic. Friends, this concept arose in India, and I wish that we all learn this concept thoroughly. It is our proud and privilege being Indians that we learn this concept from the Indian, which is invented by the Indian scientist, Dr. Rajul Vasa. It is our moral duty also, being a professionals, to learn this concept, and India should be the hub of this concept as far as the neuro rehabilitation is concerned. If we are failing to do that, it would be shameful for all of us being Indian physios, actually. So we should take the advantage of the Dr. Rajul ma'am. She is here in India, and she's the scientist who has invented this concept.
I totally agree with you.
Thank you. Dimple Paija is asking one question. Vasa concept on totally on center of gravity and about balance. Then I have arise one question, ma'am. It is used in Parkinson disease for reduced rigidity and balance problem.
Well. Because Parkinson is also degenerating diseases, Dr. Vasa recommends to enjoy life, king size, and eat the medicines. But this might change from country to country.
Jatin is having one question. I have seen many patients which has treated by Vasa, and they also improve their speech. So how it works? If this topic will be covered in next topic, then it is fine. It is a wonderful question. I think Jatin, you have asked a wonderful question, and not only speech. I have seen that patients are getting their eyesight back, that hearing abilities back with this concept. Am I right, Mari?
Yeah, that is true. And this question is very good.
Yeah. Yeah, please answer.
This is something that you will learn when you continue with Vasa concept journey. Dr. Vasa is very good explaining how message comes from different parts of brain to another. But the point is that when you are really reorganizing the brains, the speech, the neuropsychology, and movement and everything just comes because we are now treating the root cause. So of course everything just emerges in there. But very good question, and this is something that I would really like to do research about, because this is so interesting how using the body, brain and gravity will give such amazing results with speech and everything else.
Yeah, actually, we were going to show one case testimony with the hearing improvement of the patient, auditory improvement of the patient. But because yesterday's program was quite lengthy, then we thought that we will present it today. But somehow we couldn't manage it. But tomorrow we will make it a point that we will show viewers that case study also.
Very good. That sounds so good.
Yeah. Yeah, Janvi, please ask the questions if you are having.
Yeah, there is a question from Indrani saying how it changes as country to country.
Well, in Finland we have much less population, and we are so hardworking people. So we might give some exercises, but they can do exercises only little if there is degenerating disease. The main point also in Finland is that they need to enjoy their life king size.
As I am not able to find any more question, Dr. Neeraj, if you can find.
Yeah, is it helpful for muscular dystrophy?
Yeah, there's also the same that it is generating diseases.
And muscle dystonia?
Yeah.
Okay.
I think that is degenerating disease.
This was the dystrophy question. Yeah, this is again a good question. Is Vasa concept helpful in eye squint in adults?
Is Vasa concept helpful in
Squint.
Can you write it down?
Yeah, it is squint. SQINT.
I think that is also degenerating disease. And the same question for all of those, or same answer for all of those. So enjoy your life. Is there any questions left?
Sabha is asking, is there any age limitation for Vasa concept?
Gait limitation. Actually, I don't want that my patients are walking before they are ready to walk. I hope that
She is asking about the age limitation.
age limitation. Sorry, I heard gait limitation. Age limitation. At least I haven't seen any problems with older patients. Of course, we are doing exercises over the bed or something soft area, but it is still working.
Yeah. Apsa is asking, Vasa concept is applicable in other neurological conditions rather than CP, ME, or hydrocephalus.
Okay.
Yeah.
Do we have some?
Did you listen to my question?
It's now there. It's for brain injury patients. Vasa concept is best for brain injury patients. Maybe we first help them and then we are thinking about the others.
Okay. So if someone is having peripheral nerve injury, can we apply this same concept, or we should not try it out?
Can you repeat?
Yeah, if patient is having peripheral nerve injury problem, then can we apply this concept, or we should not try this concept for the peripheral nerve injury problems?
If the reason for those problems is in the brains, then you can do the Vasa concept. But of course, you need to consider everything when you are doing the exercises.
No. My question is that if it is not related to the central nervous system problem, it is related to the peripheral nervous system injury, then also can we apply this concept, or it is mainly restricted to the central nervous system problem?
I think that today we are focusing only these brain injury patients. You can try to do Vasa concept with all of your patients in good amounts of those patients, but now we are focusing only these points.
Bandari Gracie is asking that is Vasa concept useful in stroke patient with post hip replacement?
If TBI has affected on the both sides, you can still do Vasa concept, and it's still good for the patients.
Yeah, Nisha is asking that there is a CP patient who was treated with other concepts for last 15 years and still unable to walk or sit. Can it be treated with Vasa concept?
I think that you can try always to do Vasa concept.
Yeah, and Disha, I must tell you that you should apply Vasa concept for this patient. That will definitely bring some change in the patient's condition, that's for sure. Because yesterday we had a patient who who was a CP and started Vasa concept after 15, 16 years of time. And now he's recovering well, he's sitting well, he was playing the piano and all. So I think Raj is the name. So definitely, and it can be helpful. Yeah, this is a good question. Can it apply to post polio syndrome?
For what?
Polio.
Polio syndrome.
Yeah.
I don't know, because in Finland we haven't had polio in 50 years, so I don't know. I have never asked question like this from Dr. Vasa.
Yeah, friends, we will try to get the answer from Dr. Vasa, and if possible, we will give you the answer by tomorrow. Because Finland is polio-free country, so there are no polio cases so far, so they haven't asked this. Even India is becoming polio-free. That is a good news. But some few old polio cases are still there, and they are suffering. So that is the intention. But nowadays, because of the efforts of the Indian government, India has become the polio-free country now.
Very good.
I think, yeah. What is the main difference in Vasa concept from other concept like Bobath? I think you
I think,
answered. Yeah.
yeah, I think that I have answered for this already, but it is that we are treating the root.
Yes. This is asking, Ayushi is asking, is it only for neuro patients? Does it involves NDT or Bobath exercises too?
Patients are doing only Vasa concept, not Popat or something else at the same time.
Is it useful in neuromuscular disease? I think NMD they are asking for.
Sorry, I cannot answer that now because
Yeah.
I should read the question that neuromuscular disease. When there is degenerating disease, Dr. Vasa is still recommending to enjoy the live insights and eat the medicines.
Is this helpful in spinal muscular atrophy in kids?
Atrophy is also degenerating diseases. So I can answer all of those questions which are part of the degenerating diseases that today we are focusing only stroke and TBI and CP, only with brain injuries.
Shall we take questions for next 5 minutes and then we will wind up the show? Is that fine for you?
Yeah, that's very good. Thank you.
Friends, please don't write any more questions in the chat group. We are already having so many questions. We won't be able to cover all of them. So we are trying to cover maximum, but now do not write any question. You can ask tomorrow as well. Ma'am, this is the question from Bhushan Patni. Our daughter Navya is a Vasa concept student. We are facing problem with her stamina. Can you suggest way to improve her stamina so that she can do exercises for long duration?
If the daughter is doing a Vasa concept, I think that Dr. Vasa is part of this rehabilitation. So it's good that you are talking with this thing with Dr. Vasa. I don't want to be in the middle of there. So
Yeah, very
contact
true.
to Dr. Vasa straight away.
Ravish is asking, Vasa concepts affect our psychological structure? If yes, how it works?
It's also a part of the when we are treating the roots, then the brains are starting to work and send the messages in the right way, and of course it is affecting the whole person. It is affecting the mental side and it's affecting the neuropsychological side because the brains are starting to work.
Rima is asking, ma'am, how Vasa concept help in bladder and bowel activities?
It's also part of that when brains are starting to work, of course, they are sending much better influencing on our inner cuts that how it should work. And that is the reason. Brains are sending information on much better way.
Yeah. Manoj is asking, can Vasa concept regenerate the lost neurons or working on alternate pathways?
I would say that there's the alternate way. There's lots of neurons in the brains that we are not using, and the cerebellum is there's so much neurons in cerebellum that we can use those.
Okay. Vinaya is asking, does Vasa concept help facial palsy associated with hemiplegic patients?
Yes. That was easy to answer. Yes, I have seen that.
Actually, it is a quick question round, rapid fire session, because we are having just 4 minutes left to find up the things. What is the recovery rate of Vasa concept for stroke and CP? Does improvement occur in all patients?
I don't know the recovery rate. I don't think that anyone has done research like it. But I have seen improvement for all patients who have done the exercises. It doesn't matter if there's 1 year or 10 years from the brain injury. If you are doing the exercises and you are doing those daily, then you are having the results. So there comes improvement. But the key is that you need to do the exercises and not to do all the things that may not be good for you.
Yeah, Rajeshwari is asking. She asked the previous question about the AVAN disease, ANAVN, and you said that you don't know about that, and she has explained the disease itself. The AVAN disease is a rare inherited disorder that damages the ability of nerve cells in the brain to send and receive messages. Group of genetic disorders called leukodystrophy, leukodystrophies.
Okay, thank you for explaining this. I will do Vasa concept with all my patients, but I don't know more about that disease. So actually, I cannot tell more. I do that with all patients, and I have had results.
Yeah, means this is again a brain disorder, this condition which is related to the brain problem. So, does this concept be helpful? What do you think? So, that's what I think Rajeshwari is asking for.
I always tell that try. Then you know is it helpful or not.
These are vague questions about the time frame. How much time does it take to recover? It is very subjective and it varies from patient to patient. There is no point. Yeah, Ruturaj is asking, can it help in higher function disorders or just a spasm or a spasticity? I think a spasticity is a better word than a spasm.
Vasa concept is very good for treating spasticity or ataxia or all that kind of like things.
Absa is asking if there is sensory impairment, how you will get it back with Vasa concept.
I showed the one picture what needs to happen in the body, that you can have the sensory and you can have the movement, and you need to fix the whole body that you can see the difference. So the sensory impairment is it is coming better if you just do the Vasa concept. It is because the roots are fixed.
Yeah, perfect. There is a question on Parkinson disease already you have given. It can be applicable. And Dr. Vasa is telling live life king size.
Yeah.
Can we do this type of exercise in lymphedema patients?
At least I have done. I think it depends how big the lymphedema is.
Ma'am, we will take last question and then we will wind up the show. Is that fine?
Yeah, that's good.
Yeah. Rajeshwari, you are asking about, please take your question tomorrow. Already we have answered your questions, so please consider that. Yeah, Malik is asking how Vasa concept improve cognition in TBI patient.
I think that I have already answered this because it's same that in stroke patients, that when your brain are starting to work, then the cognition is getting better. And I told it previouhand that speech and the neuropsychology is the things that I would like to do research about, that how doing Vasa concept exercises you are getting benefit for everything, to your speech, to cognition, to everything. Things are happening, everything happens, but it is when we are fixing the root, everything emerges automatically.
True. Yeah, thank you very much. Before we finish the show, I would like to inform the viewers about some queries regarding the filling of the forms. Friends, our forms are, you can fill the form by tomorrow morning 9 a.m. Indian Standard Time. So don't worry, if you haven't taken screenshot of your chat, you can go back to YouTube. Once the program is over, it will be uploaded on the channel, so you can again see the program and you can take the screenshot and you can upload in the form. Please take care that you do entry only once only. So if you have entered your entry once, again you cannot enter with the form. So you make it a point that you have all the screenshots ready, and then you open the form and submit the form at one stroke only. You cannot do multiple entries in the form. So please take care of it. Yeah, Janvi, please, you tell.
Yeah. Thank you, Dr. Berry, to share very useful information about the Vasa concept. It was really very informative session. Thank you once again, making your time free from your busy schedule for the session. And we look forward for tomorrow's session as well. So dear participants, make sure that tomorrow we will start at 7 p.m. And if you have any query, you can reach out to us. I and Dr. Neeraj are always available. Thank you all the participants for your active participation. Thank you, Dr. Neeraj, to organize this FDP on this platform. It is really helpful for all the physiotherapy community members. Thank you.
Thank you very much. Thank you, Oro University, for organizing this event with us. And thank you, Mari. I really appreciate the way you are giving your time to us just for upliftment of our knowledge. Thank you so much. I thank Dr. Rajul Vasa and Vivek sir and the entire RVF team for supporting and for organizing this Without you, it is impossible to get such a resource person on this show. Thank you so much for that, and thanks for inventing this wonderful concept to the humanity. We really salute your knowledge and your humanitarian approach as well. Thank you so much, Mary, once again. Thank you, Janvi. Thanks a lot, all the viewers. See you tomorrow evening once again at 7 p.m. Indian Standard Time and 4:30 p.m. at Finnish time. Thank you so much.
Thank you.